in low-income countries, right? About $11 per capita is spent on health in a year from foreign aid, and 10 comes from within the country. It's about $21 per capita. Compared to high-income countries where the number is about $5,000 per capita. Yeah, 5,000 to 21. Just gives you a sense of scale that in low-income countries, 11 per capita. In lower middle-income countries, it's like I think 47 to 400 and something. So again, these are small numbers relative to what people in a country really need to live healthy lives. And ultimately, the biggest determinant of how much money is spent on health in a country is how much money the country makes. It's not how much money comes from outside, it's how much money the country makes. So again, for me, thinking about solidarity in ways that is not just global north pointing, but also global south pointing, and saying, how can we in country X achieve the higher revenue that allows us to spend money on health?
Māori and other Indigenous communities embed a commitment to multi-generationalism, and that's a commitment to pursue projects that span several generations and that will only come to fruition long after the present generation are gone. Right? And our global systems, health and otherwise, I think can learn from such a commitment and can do much to enable these forms of kinship networks and solidarity too. And to do that, and to borrow again from Kyle White, we could say that these systems must cultivate a closer degree of mutual respect for different sources of knowledge, different cultures, and different situations. Such global health systems will need epistemic infrastructures that recognize the fundamental role of Indigenous and other local knowledges, for instance, for conceptualizing, for pursuing, and for realizing global health. They'd rely on policy infrastructures that recognize and enable Indigenous and other social practices to pursue just and thriving socio-ecological futures. And then finally, they would need to recognize all of the kinship networks of solidarity that already exist, as well as enable those that could still exist globally too. Kia ora mai tātou. Thank you so much.
How research funding is seen, the framing of the question we were giving for this is that it isn't necessarily usually seen in the context of solidarity, it's seen as aid. That term, ODA, Overseas Development Assistance, is clearly one that is used in the funding field, and it's particularly that is being cut by many countries around the world currently. What I'd like to say in respect to that is I think that the framing of that in research isn't necessarily so obvious. Research is primarily about developing new concepts, finding new ideas, finding solutions. And to me, that has more of a basis to solidarity in it than the idea of aid. And I think this is useful at this time of overseas development assistance cuts, is to fall back on the framing of what is research for. And if you see research as for the generation of knowledge, and if that knowledge is of use to multiple partners, some may be high income, some may be low income, but that is to answer shared problems, then I feel that is a potential route by which we can get out of some of the current issues of research funding being seen as aid, by reframing it as it being seen as providing solutions to shared problems.
Funding is critical, funding is important, and funding must follow. But I also think we can't let funding and the lack or the availability of funding dictate what is important. What is important remains important regardless of whether the US administration wants to fund it or not. It's still important. It's a fundamental reality. And therefore, it is imperative that all of us look forward. And that's what solidarity is about, is saying this is so important that we will make this happen with whatever tools are available, be it great amounts of funding or less funding, we will make this happen.
There is a risk that with this inflation of solidarity rhetoric, the term becomes a kind of empty signifier, right? Or that it becomes used as an argument by countries to say, our people come first. Again, this is why, it's one of the reasons that this project exists, that Seye is leading. This is one of the reasons that we're bothering everyone with this kind of analytical framework. We need a framework in hand that enables us to say what you're doing, maybe you call it solidarity, but it's really not that. It's really something else. It's charity, or it's merely rhetorical mobilization of solidarity. It's not what solidarity means in the context of global health.